This video is talking about adaptive pain. It's a good pain, and it is the reason why a lot of people never fully recover and reintroduce activity after experiencing injury or pain. Previously injured tissue repairs with the reproduction of cells and the formation of scar tissue. Injured tissue doesn't regenerate, it repairs. So it's never the exact same as it was originally. It would be very helpful for people overcoming injury to understand a little bit more about tissue healing, pain and recovery. Previously injured tissue, even when healing is complete, retains an element of extra sensitivity. This can go on for months or years. It doesn't mean that the area is still injured. It doesn't mean that you're damaging that area. It doesn't mean that you should stop activity. This is protective in nature. It's for our benefit. It tells us that the area needs ongoing extra attention. It needs a little more stress and suitable movement thrown in. It demands an extra warm-up before more strenuous movement or exercise. This pain isn't bad, it's adaptive. It should guide us, and it is a useful mechanism to dictate our behaviours over the following months. It does not mean that you have re-injured yourself or that you are still damaged. If people accepted this more, far more people would return to normal activities and exercise more frequently, far quicker than they currently do. However, most people stop on the resumption of activity when they feel any pain, even when the tissues have healed. As I mentioned previously, if you have a previous injury, that area can stay more sensitized for several months afterwards, and we are fearful and cautious around any sort of pain. This fear is often reinforced by health professionals and well-intended loved ones who encourage rest and protection of the area and protection of our bodies. But that is not helping us. In previous generations, our daily activity levels were sufficient to improve fitness and function. Nowadays, most of us have days of prolonged rest from a tissue usage or tissue stress point of view. That's where our lives are at the moment. Fear of pain and fear of injury by patients and therapists keeps our activity levels far too low for far too long. Staying physically active and strong is a great way to prevent pain from returning post-pain or injury and ensuring you get back doing all the things that give you enjoyment in life. It can take months for some tissues to fully repair, but pain can be gone in a matter of days or weeks. So unless people continue to improve their fitness and their strength, adequate repair of that tissue is unlikely, making injury far more likely and getting stuck in that cycle of pain, rest and weakness. Some of this comes from our unwillingness to accept this good protective pain on the resumption of activity and continuing to proceed with caution and gradually progress over the following days, weeks or months. Instead, we see all pain as very negative. All pain is causing damage, and all pain meaning you should stop and protect. This pain is sensitivity in the tissues. It's not damage. It's informative, and it should be more widely accepted as a normal part of the recovery process. The relevance of this, in my opinion, is significant. If people are unable to enjoy exercise or return to their valued activity, it impacts their mood and their stress levels. A lot of conditions are chronically underloaded in healthcare, and oftentimes your pain would go away if you just kept going. Pain has a sociological impact, and not understanding how it works can lead to anxiety and needless suffering. Avoiding pain is completely understandable and the right thing to do early on in the first few days or week. But if it goes on for too long, it becomes a major barrier to recovery. Fear and avoidance lead to very poor coping strategies, and people become helpless and do nothing to help themselves, expecting some treatments to just fix them. When you avoid exercise, activity and movement, you fall into this pain, rest and weakness spiral. And this makes pain in your life with more and more activities far more likely. Likewise, when our pain reduces or goes, we stop moving and exercising, or even stop doing the things that helped us get there in the first place. This is where we need to take a little bit more responsibility for our health status. We do not automatically have the right or the luxury of feeling perfect or having no pain. You don't have to be fit or strong to be pain-free, but one of the best tools we have to keep ourselves feeling good is to exercise and to stress our bodies. To summarize the important points, there is such a thing as good pain. You just haven't been made aware of it. That's not the narrative that's there in the health space. It is pretty much mind your pain, listen to your back, be careful, avoid it, listen to your body, don't do too much. That is not helping people. It makes sense for a few days, but after that, the approach needs to be vastly different for most people. Pain should be seen as a normal part of the recovery process. You often need to work with it and get through it for that pain to go. Instead of thinking, I need this pain to completely go and then I'll start going back doing X, Y, or Z. You need to actually start doing X, Y, or Z in order for your pain to eventually go. If you stop at every sensation of pain and have an all or nothing approach and just give it more rest, this pain, rest and weakness spiral repeats. We know now that pain doesn't mean injury, and we know that pain can persist long after the injury has actually recovered. So gradually increasing your activity levels is a great way to get back doing the things you enjoy, and is also a great way to get rid of your pain. If you are frustrated and unsure about what to do and have pain lingering or have stopped doing activities that you used to be able to do, feel free to reach out, comment below or reach out and we'll be glad to help.